Hello everyone, I'm Dr. Momocha Thangjam, consultant radiologist of Babina Diagnostics, and I will be taking few questions posed by the followers of Girl Up Manipur, which is the very first Manipur-based club under Girl Up campaign initiated by UN Foundation. I feel very proud and privileged to be a part of this campaign and would like to raise awareness regarding COVID-19 using this platform. I will be taking the questions one by one, so let me start with the first question. Will the heart and lungs of someone who was infected with COVID-19 be affected and or damaged? Which tests can be done to find out if there is any damage? Well, possibilities of both lungs and heart are always there with COVID-19, more so of the lungs, because COVID-19 is basically a respiratory tract disease. So, if a person becomes COVID positive and develops either cough or shortness of breath, then he or she can undergo tests such as chest X-ray or HRCT under the requisition of the treating clinician. HRCT is basically a type of CT, the full form of which is high resolution computed tomography. In that scan, we can find out the area of involvement of the lungs by the infection, and we as a radiologist give a severity score as to how much of the lung involvement is there, and accordingly there will be management of the patients. So for cough and breathlessness, if we have to check the lungs, we can go for a chest X-ray or an HRCT. Coming to the heart, coronavirus can cause inflammation of the heart muscle called myocarditis, or it can cause thrombosis of blood vessel, thrombosis meaning thickening of blood within the blood vessel, which can lead to blockage, resulting in myocardial infarction, or what we commonly known as heart attack. So a COVID patient can develop heart attack or myocarditis. In order to check the status of the heart, we can go for an ECG, we can go for a troponin test, which is a blood test to find out whether the heart muscle is damaged or not, checking the enzymes, or we can go for an echocardiography or even an MRI of the heart. But the most basic test is the ECG. The next question is there a possibility of a new strain of COVID-19 emerging? Well, it is no more a possibility now because there are multiple variants which are in circulation in the population. The most famous ones are the UK variant, now known as B116, the South African variant, the Brazilian variant, and these variants are named according to the places where they have been detected for the first time. In India, we have the double and the triple mutation variants also. Well, it is not an unexpected phenomenon because viruses tend to mutate and modify as they spread, and coronavirus is no exception. And from what we have experienced, the new corona variants seem to be more infectious. That is, they tend to spread faster and in a greater way. And regarding the lethality, which is the ability to cause death, the earlier studies showed that the new variants seem to be of similar lethality as compared to the original virus. But what we can gather from the second wave, which is happening in India, with number of deaths increasing, I feel that the lethality of the new variants have also increased. Coming to the third question, what is the relation between periods and getting vaccinated against COVID-19? No relation whatsoever. It is completely safe to get vaccinated during your menstrual period. Taking the fourth question, why aren't those below 18 years of age not getting vaccinated? Is it because even if you get infected, there won't be any major complications? When will vaccination start for our age group? It is about priority in this particular aspect. COVID vaccination program is done phase-wise. The phase 1 was dedicated to the health workers and the frontline workers who are the susceptible lot of people. Then came phase 2, which is dedicated to the elders above 60 and those above 45 with comorbidities such as hypertension and diabetes, since they have a tendency of developing serious complications and even death. The third phase, which just started on 1st of May for certain states in India, this is dedicated to above 18, and it is taken that younger people have better immunity, so they have less chances of developing complications. So above 18 people have been clubbed in the phase 3. And as we all know that no age is completely immune to the COVID disease. As we can see in the second phase that a lot of young people are getting infected and developing serious complications and even dying. So we should get vaccinated as soon as possible. Coming to the age group below 18, that those children, they were not included in the study trials in the production of the vaccine. Vaccines like Covaxin and Covishield, which are available in India, the study trials did not include children. So we cannot say for sure how safe the vaccines would be to these people and how their bodies would react to the vaccine. Hence, for now, no vaccine is available for below 18 years of age, but there are studies going on. The trials are going on. I think they have reached phase 3 for now. So once they get approved, then these vaccines would be available for the people below the age of 18, and we can all take that. So for now, stay safe with masks, social distancing, and also hand hygiene till the vaccines are available for below 18 years of age. Taking the fifth question, I was once diagnosed with asthmatic bronchitis and sometimes need an inhaler. Plus, heavy smoke and strong scents sometimes act as triggers. Will it be okay for me to get vaccinated? According to the guidelines, it is essential for asthmatic patients to get vaccinated as soon as possible because patients with asthma or chronic bronchitis tend to have a compromised lung function as compared to healthy people, and they have higher chances of developing serious illness and complications. But I think it is completely safe to get vaccinated. From my personal experience, I have seen many of my relatives and friends who have mild to moderate asthma taking the vaccination and not developing any kind of problems. So it is best to get vaccinated as soon as possible. I will be taking the sixth and the seventh questions together. The sixth question, will there be any problems for underweight people to take the vaccine? And seventh question, can Takayasu patients take the COVID vaccine? Well, the vaccines are completely safe for both of you. You should take them as soon as possible. The eighth question, is it okay not to take the prescribed medicines if there aren't any post-vaccination symptoms such as fever after getting vaccinated? Well, if you do not develop any of the symptoms such as fever, body ache, the common symptoms post-vaccination, you may not take it. It is not compulsory to take these medications. Paracetamol should be taken SOS. That is, if it is required, if you develop the symptoms, you take them. Otherwise, it is not necessary. Why take medications unnecessarily? So, lucky you if you do not get the symptoms, and then it is completely fine. The ninth question. Can people with food allergies get vaccinated? Well, here it depends on the degree of allergy one is having. If you've had severe ones like anaphylactic reaction with any kind of food, I think it is advisable for you not to take the vaccine for now. But people with mild allergies, some kind of little rash here and there after having food like brinjal, I think we can try taking the vaccine. I, for myself, have a lot of allergy issues, but then I have taken the vaccine and no adverse effects I could feel. So it depends on person to person, but if you're having just mild reactions or mild allergy conditions, then I think it is okay for you to take the vaccine. But once with severe reaction to, drugs which you've had before, medicines which you have had before, or even the first dose of the vaccine, if you develop severe reaction to it, I think it is not advisable for now for you to take the vaccine. The last question, how safe will a person be after taking the first dose of the vaccine? Well, according to the studies, the efficacy of both Covishield and Covaxin are around 70% after the first dose, which increased to around 90% after the second dose, that is weeks after the second dose. But we have to remember that no person is immune to the infection even after the second dose of vaccine. We need to follow the standard protocols of social distancing, masks, and also hand hygiene even after vaccination, because vaccination does not make the person immune or completely protected from the infection. You can still get the infection. What the vaccine does is that it reduces the severity and also it can prevent death. It actually prevents complications from happening, but it does not make the person immune. So even after vaccination, one must follow all the protocols that we have been following. So these were the 10 questions which were raised. Hope my answers will be of some benefit to all of you. I would love to be a part of such campaign in the near future as well. Till then, stay happy, stay safe, take care.